Oftentimes when patients come to see me for a rhinoplasty consult, we're not just addressing cosmetic issues, but there's medical issues as well, such as their nasal airway and breathing through their nose. That's why it's really important to make sure that you find a surgeon who's trained not only in the cosmetics of nose, but as well as the function. That's where my background as a board-certified otolaryngologist or ENT doctor is really important and plays into my rhinoplasties. I not only am able to assess the kind of form of the nose, but as well as the function. I've been operating on the nose since day one, and it's really important that patients are able to breathe out of their nose as well as it look good after surgery. So one of the first things that I assess during a rhinoplasty consult is I look inside the patient's nose, I assess their septum, I assess their turbinates, I make sure there's not any underlying sinus issues, and then I move forward to addressing any cosmetic concerns that the patients may have in addition. When patients come to this office seeking a rhinoplasty consult, sometimes they know very specifically what issues or concerns they have, and we're able to address that. Other times they're unsure what those issues are, and they feel that their nose just doesn't fit their face or there's something off about it. This is where the 3D morphing software really allows us to nail down the specifics. Even with patients that specifically know what their issues are, I'm able to make direct real-time changes to those photos and show them, and patients get instant gratification of knowing what simulated surgical results are. When patients are unsure what the issue is, it gives us the ability to change different areas and see how it really affects their face and the proportions. This way we can really nail down what the issue is and make sure that the patient and I are on the same page for what their surgical results are. One of the most common questions I get asked about rhinoplasty is how much downtime there is associated with the procedure. I usually tell my patients 1 to 2 weeks. My patients that have more physical jobs, such as waitresses or hairdressers where they're on their feet all day, I recommend a full 2 weeks. People with desk jobs are able to go back to work after a week. Most of the time, my patients aren't taking any pain medication after the first 24 to 48 hours. Oftentimes, most of the discomfort with surgery is related to nasal packing. 90 to 95% of my patients don't have any nasal packing post-operatively, therefore have very little pain or discomfort.